So let's talk about those that are now recently diagnosed with cancer, and they are now on that roller coaster ride of a treatment plan that may involve surgery, radiation, hormones, immune therapies. And that patient is wanting information about what can I do to help improve my outcome. And again, this is a wonderful opportunity to bring a dietitian into play to help tailor and provide recommendations for that individual. And throughout that treatment phase, we have a great need for more research. If we look at the accumulated research for etiology and prevention, and we look at the amount that we have for what is the optimal diet for specific therapeutic interventions, that data is modest. We need an enormous amount of effort focusing on how do we optimize the therapeutic outcome, meaning how do we eat well and improve our fitness during therapy so that the efficacy of the treatments are better, and at the same time reducing the risk of undesired toxicity and side effects, both short-term and long-term. And this is an area where we've done so little research. And it's also a period where treatments impact what people are consuming in a way that they're at risk of malnutrition for other specific nutrients. So we really need to have a very carefully orchestrated interface between the registered dietitian, the clinical team, to optimize this outcome. Technically, survivorship is defined as beginning on the day of your diagnosis, but for this discussion, I want to focus on that moment when your treatment has been done and perhaps achieved the success that you want, which is a complete remission. This is a moment when many individuals are vulnerable to nutritional misinformation because they finished this roller coaster ride and they are now on their own, and they truly have a teachable moment where they want to learn what can I do to help myself so that this experience never happens again, or that cancer will not return. And also, how can I best deal with the risk of some of the side effects of therapy that may not show up for years to come. Many of our treatments, such as radiation to the chest, or some of the drugs that we use, can impact coronary artery disease. Likewise, drugs like cisplatin for testicular cancer could affect the kidneys. And many other types of chemotherapy are being associated with something called chemobrain or cognitive dysfunction. So there are so many potential long-term effects on health of cancer therapy that we truly want to bring food, nutrition, and fitness into the prescription for future health. This is another very, very important point in time where patients need to appreciate the guidelines that are in the new report, and dietitians can tailor with them very specific patterns that will also reduce the risk of some of the other long-term effects of cancer therapy. So we truly want people to finish their cancer therapy and move forward with longevity, but particularly high quality of life.